Okay, hi everyone, and welcome to the final lecture. Today we're going to focus on microbial diseases of the skin, eyes, and the nervous system. And we'll go through them one by one. So this first slide here that we cover, I want you to circle, star, highlight it, because these terms come up not only on the exam, but in all of your other classes, especially nursing-based or medical-based classes, as well as any case studies or information that you will read as you move forward in your career. Now, what we have here are the different terms that you'll encounter for different types of lesions. And I basically put them in order of least gross to most disgusting. Okay, so the first lesion that we have is a macule. You see over here. These are any of the flat, non-palpable lesions, meaning they'll be flat and they won't be raised up, able to be kind of touched. The way palpable means it's raised up, it's touchable. On the other hand, now is raised up. Okay, so what I like to do in my notes is circle or underline the PA and papule to remind myself that it is palpable. Okay, it's raised up and touchable. Then when you move to a vesicle, now it's not only palpable, but it is fluid filled. And there's another term I want you to remember for vesicles because you see them a lot in case studies. And that term is bulla, B-U-L-L-A. A bulla is simply when it's a very large vesicle. So basically greater than half a centimeter in size. So sometimes you'll hear infections or diseases referred to as bullous, B-U-L-L-O-U-S. And if it's bullous, then it means that it produces lesions that are very large and fluid filled. The last category that you encounter are pustules, and that's similar to a vesicle, except that this one is specifically palpable but pus filled. So instead of saying fluid filled, pustules are pus filled, meaning that they have a mixture of white blood cells, cellular debris, and dead tissue in them. Like I said, the most disgusting. So here's a recap just to remind you all the terminology, and it includes the term bulla, which I said is important to know as well. Wow, will you look at that, bold and red in color. Wow, that would make a great multiple choice question. What we have here is the most common of the skin infections, and that is acne, something that I'm sure a lot of you have had experience at one point or another. I know, we were especially plagued by it in the hormonal younger years. And when it comes to acne, there are a few different things that can cause acne. And, most people think of hormonal, clogged pores and oil, which you see on the slide referred to as sebum, as causing acne. But not all forms of acne are simply hormones and clogged up pores. Some of them are actually infections, specifically caused by really long word bacteria, Propionibacterium acnes. And now that's kind of where you see that some people who struggle with acne, they'll try all of those treatments and cleaners and cleansers and exfoliation and all that, and they won't see improvement. And that's because in those cases, it's an infection, it's bacteria. And so what they end up needing is a prescription to kill the bacterium. Okay, so just keep in mind when you see acne, it's not always hormones and clogged up pores, that sometimes it's from an actual infection, and it ends up being the most common of the skin infections. So circle that title, put stars next to it. Now when we go through skin infections, you'll see some, bacterial friends of yours that you remember from other lectures and from lab especially. So on this slide, for instance, you see that Staph epidermidis and Staph aureus both end up causing skin infections. And we mentioned with Staph epidermidis that he's normally not one of the bad guys. In fact, 90% of your normal skin, normal flora, is made up of Staph epidermidis. But like we always say, when you think of these things, normal flora especially, they can be opportunistic pathogens. So he can end up causing various infections. You also have the big bad guy from lab, who is Staph aureus. And Staph aureus is not just going to be seen in terms of staph skin infections, but also things like food toxicity as well. Now, with Staph aureus versus Staph epidermidis, you recognize some information from lab, and that's kind of the key point that I want you to put on this slide, is distinguishing these two species of Staphylococcus. Okay, so first of all, you notice this term here, coagulase negative epidermidis versus coagulase positive aureus. So make sure to write on this slide and circle star highlight the fact that Staph aureus is coagulase positive, so you can test it using the coagulase test, specifically by using rabbit plasma. And if it solidifies, boom, that's Staph aureus. Another thing I want you to remind yourself of on this slide and to put stars next to is if your patient is suffering from one of these two infections, Staph epidermidis or Staph aureus, what's an antibiotic that they are both sensitive to? Right away, you should write down novobiacin. Remember, Staph epidermidis and aureus get killed by novobiacin, whereas saprophyticus did not. So if your patient is suffering from a staphylococcal skin infection of epidermidis or aureus, you would want to use novobiacin as one of the options, and they'd both be sensitive to it. The last reminder that I want you to write on this slide is the idea of partially why Staph aureus is so pathogenic. And if you remember hemolysis and what that means, remind yourself that Staph aureus is beta hemolytic. So beta is bad. Chews up or destroys all of the red blood cells. Okay, so produces some nasty toxins and can really do a lot of damage. Now, when we talk about staph skin infections, you're going to see a lot of terminology, kind of like when we just went over lesion terminology. I want you to know the difference amongst them. So first off, you have folliculitis and staph infections. Okay, so folliculitis is specifically when the staph skin infection has targeted the hair follicles, and it becomes referred to as a staph if the hair follicles are specifically those of your eyelashes. So you would only have a staph on your eyes, whereas anything on, let's say, your scalp or even on your hair follicles on your arms or legs, that would be folliculitis. The other terminology difference I want you to be aware of is a furuncle versus a carbuncle, which I know are kind of funny sounding words. With a furuncle, this is a boil, like, I'm sure a lot of you have seen lovely gross pictures of boils. And that's a type of lesion or abscess where you end up with a lot of inflammation and pus. So it kind of looks like in the lesion slides when we were talking about the really gross vesicles and pustules. So now this would be like a pustule. And if that ends up getting very deep and pretty much spreading and to a sepsis level, then it becomes a carbuncle. And there's a trick that I have for remembering that a carbuncle is simply a very deep spreading furuncle. And that is circle or underline car at the beginning of carbuncle. So car, you think of a vehicle, car is traveling. So carbuncle is once the furuncle or boil infection has traveled deep tissue and maybe going septic. Then we have a few different conditions that we kind of list out over on the bottom of this slide, which is impetigo, scalded skin syndrome, and toxic shock syndrome, which you've also heard in lab, and is not only caused by Staph aureus or staph infections, but you'll also see with strep pyogenes infections as well. So when we talk about these infections, notice impetigo says non-bullous sores. So they're not going to be the very large vesicles in that one. But most importantly, it says spread by autoinoculation. This is something I want you to pay close attention to because so many people don't realize that it's actually you who spreads your own infection sometimes. So autoinoculation means that with a lot of your skin infections, you self-spread them from one body part to another. So for instance, if you started off with having a skin infection on your neck, let's say, well, you go to scratch it, and then without washing your hands, now you go to rub your eyes. Well, you just traveled, you spread that infection from your neck to your eyes, okay? People do that all the time with their scratching, their wiping, kind of think of when you wipe sweat off of your forehead and all. Well, now you may be spreading infections that you had on your hand or your arm without realizing it. So that's what autoinoculation means. It means you spread microbes from one part of your body to another part of your own body. The next infection that we mentioned here is scalded skin syndrome, and you have a picture of that on the bottom. And what I want to point out here is the fact that it says bullous impetigo. So this is when regular old impetigo has gotten worse, particularly from toxins being released from the Staph aureus. And with this, now it's bullous, meaning bulla, so the very large version of vesicles. So this will have very large lesions that are fluid filled. Okay. The last one is toxic shock syndrome, and that one is very sad because we also show it with strep pyogenes as well. And the reason that I say that one is sad is because this is the one where you see people your own age, 19 through 23, if you look up in the news and whatnot, you see they've had amputations because of toxic shock syndrome. So for instance, there are a couple of famous models who are only 19 and 23 years old when they had to have their legs amputated because of toxic shock syndrome from improper use of tampons. So always be very careful, the female students, when you are dealing with anything like tampon usage, because as we go over in medical micro, it's very easy for that to trigger toxic shock, septic, staph infections, because think about it. For instance, if girls are using super absorbent tampons when it is not a heavy flow, or they're leaving the tampons in too long, well, now in that already delicate, thin tissue area, they are now drying everything out, and then removal or insertion of additional tampons during that time period now makes micro tears in the vaginal area. Plus, you have all of this absorbed blood, which is great food and nutrients for staph bacteria. So they love it. They start replicating, and then you have the basically what we call micro tears that you wouldn't even be able to see. They use that as like a parenteral route entry to get into your body, to get into your bloodstream, and they overgrow. And then once they're traveling and they're septic, they can do major damage because, as you know, Staph aureus, strep pyogenes, these are bacteria that release a lot of toxins and can be necrotic. And so those young people ended up having to have amputations from these kind of infections. Something as simple as tampon usage ended up causing it, which is a shame. Now, like I mentioned, similar to staph infections, you also have streptococcal skin infections. And as you saw in lab, one of the big causes of streptococcal skin infections is the big bad guy, strep pyogenes. And so as soon as you see strep skin infections, there's a certain antibiotic that I want you to remember and remind yourself of. So if a patient is suffering with strep pyogenes, what can you treat it with? Bacitracin, Remember, bacitracin eats pie is the trick to remember that. Also, always remember gram staining of these different bacteria. So in the case of strep, you know that it's gram-positive, coccus shaped, and you have that strip of strep, meaning you'll find it in the linear fashion. This slide also reminds you of something else you remember from lab, which is the beta hemolytic aspect. So again, remember, beta is bad, and that's the one that completely destroys red blood cells. And you kind of need your red blood cells, so you don't want beta hemolytic bacteria infecting your body. Okay, so as I just mentioned, one of the big bad guys with regard to streptococcal skin infections is your good old friend Strep pyogenes from the lab. And with Strep pyogenes, just we already mentioned it a second ago, but for what do we already know, remind yourself of bacitracin eats pie, so treating with bacitracin for these skin infections. That's why things like triple antibiotic, Neosporin, they tend to have bacitracin in them. Remind yourself what you already know, the gram staining, what they would look like, and remind yourself about the hemolytic activity. Then what I also have on this slide is some examples of the virulence factors, which basically means the various proteins or enzymes within that bacteria that allows it to be so harmful to you, how it does damage. So basically the toxins and enzymes that help it to break down your tissues, destroy your cells, and really stick or stay in your body. So here you see some of the damage that streptococcal skin infections can do, specifically Strep pyogenes, and you saw in lab as well some of the even gorier, more dramatic photos. This guy, he can cause the common sore throat, which isn't very bad, but if he's then producing toxins and really going into that hemolytic activity, you end up seeing some very, very scarring skin infections. And so you see erysipelas, which is the first description here, which is more on the outer layers of the skin, but can also end up septic. And then you have the two that we've mentioned in lab already, which is necrotizing fasciitis and streptococcal toxic shock syndrome. So like I've kind of mentioned in lab and lecture, with necrotizing fasciitis, the two big culprits of this one are Strep pyogenes and then something called Vibrio, which you usually find in marine waters. And you see this can also cause shellfish food poisoning as well, the Vibrio bacteria. But in the case of Strep pyogenes, when it ends up causing flesh-eating disease, necrotizing fasciitis, it's mainly due to the exotoxins that it's producing. And what happens is these exotoxins end up serving as what we call a superantigen. So basically ask yourself, when you hear the term antigen, what does it mean? Well, that's the protein name tag that triggers the immune response, right? So if it's a super antigen, then it's triggering a super immune response. And you may say, well, my immune response, that's there to protect me, to help me. Well, think of a really big immune response. What else does that include? That includes a whole lot of inflammation and cell destruction, cell targeting, all this kind of stuff that can actually end up damaging your own cells. So sometimes too much of a good thing ends up being a bad thing. So the superantigen ends up causing your own body to do a lot of damage to itself. The last one here is streptococcal toxic shock syndrome, which is similar to staph toxic shock syndrome. It's very destructive. And I know before I gave the common example of tampon usage causing this, but it's not always that. In the case of streptococcal, especially, for instance, in the news not that long ago, there was a father who caught strep throat from his young son. I think the son was probably only around 8 or 9 years old. And the father's strep throat, because strep pyogenes can end up producing very bad toxins and go septic and everything, the father's version of that strep throat that he caught from taking care of his sick son ended up going into full-blown toxic shock syndrome, and he had to become a quadruple amputee from it. So something as simple as strep throat, sore throat infection, can end up becoming something where this poor man lost all 4 of his limbs. So you always have to keep in mind, be very careful of infections, no matter how mild or unthreatening you think they are, because under the right conditions, sometimes they end up becoming a very big problem. So you may think you're doing good taking care of someone who's sick, but if you're not watching out for your own safety at the same time and taking proper precautions, that kind of like we've gone over in lab, then you can end up picking up something that ends up being very, very damaging. Now, bacteria aren't the only things that could cause skin infections or skin diseases. Here's a list of a few of the viral skin diseases, and we're going to go one by one to take a quick look at them. So first up, you have measles, and what measles ends up doing is you get this rash that starts in the face, and it progresses to the really bloodshot red eyes and a really bad cough. Now, a lot of people, when they think of measles, they also associate it with mumps and rubella, because the vaccination that has now prevented measles from being the big bad guy that it used to be also covers vaccinating you for mumps, which is the swelling above the jaw, specifically the parotid gland or your salivary glands. And it also protects you from rubella, which is a face rash that you end up having for about 2 to 3 days. Now, with measles infection, the big problem with it is that 1 in 1,000 cases triggers encephalitis, and in some cases it's called subacute sclerosing panencephalitis. But either way, anything to do with encephalitis becomes a big problem, as you're going to see at the end of today's lecture, because anything that involves the brain or the nervous system can be very, very damaging. And since measles was especially big at targeting children, you definitely don't want anything in a child causing swelling of the brain or neurological damage. But again, thankfully, there's now the vaccine, which has helped really dramatically reduce the number of cases of measles. But at the same time, unfortunately, due to those anti-vaxxers who think that, surfing the internet for 10 minutes in their basement makes them scientists and doctors and medical experts, problems like measles are starting to come back up because people are not doing the vaccinations that they're supposed to, and that's now causing a problem with not having as much of a herd immunity like we should. Another viral skin infection, which we actually mentioned once before in this class, is smallpox. And smallpox is caused by pox viruses. And what did we say about pox viruses? Well, they're the ones that have a DNA genome. Okay, so remember, they are DNA genome, and they're the largest animal virus. Okay, so for pox viruses, we already said DNA genome and largest animal virus. Now, smallpox is another one that used to be a very big problem and had even affected the respiratory system and could be septic in terms of traveling through the bloodstream. But the good thing, again, about smallpox, like with measles, is the number of cases has dramatically decreased because of vaccination. So the introduction of the smallpox vaccine has predominantly eradicated this. Now, it is still in the news every once in a while as a potential bioterrorist agent. And also keep in mind that a lot of these big bad guy viruses and bacteria, they are kept or housed in small quantities at various locations for research purposes and to basically try and protect the public. But, things like that can always end up in the wrong hands. So it does pop back up in the news every once in a while. But again, the vaccination aspect has really helped protect us from it. Then there is chickenpox, which you are all pros and experts at by now because we've mentioned it before with regard to what is its genome. So chickenpox, when you hear that, genome is DNA, okay, because it was one of those on the slide that had DNA viruses. You also know that it's actually a herpes virus, not a pox virus, okay? Make sure you put a little star on this slide reminding yourself that herpes virus is a herpes virus, not a pox virus. That's very important because when you think of herpes viruses, it reminds you that chickenpox is one of the ones that can go latent. And you have to know that if it goes latent, what does it come back as? We'll see on the next slide, shingles, which is very painful because when viruses like chickenpox, causative agent, go latent in your body or dormant, they tend to do so in nerve cells. So if they're going dormant in nerve cells and then popping back up, reactivating lysing cells, it ends up being very painful. Now I want you to think of when would this be most likely to happen? When would latent infections tend to reactivate? The two big examples are one, when you are under a lot of stress, and two, when you are immunocompromised. Okay, so those are the two times that latent infections tend to pop back up. One other thing that I want you to circle, star, highlight, I've bolded it in red, is the fact that chickenpox has been associated with Reye syndrome. So, back in the day, they used to think, oh, chickenpox, my kid has chickenpox, I want them to be immune to it. Let the kids play together, let them hug, kiss, whatever. I'd rather my kid get chickenpox now rather than older. Turns out there are two big problems with that. One, if your kid then ends up during the chickenpox infection with Reye syndrome, which is usually increased by usage of aspirin as parents try to, reduce fever and whatnot. Reye syndrome ends up causing brain dysfunction, which you do not want in your child. Secondly, like we just said, once your child has been introduced to chickenpox, now they have the potential to have shingles at any point in their life, which is much more damaging and painful than the initial chickenpox infection because, again, this is now once it's been in the nerve ganglia. The good thing is they have developed a vaccine for it, and if you get the vaccine, then you won't have to worry about chickenpox or shingles down the line. So as we just mentioned on the previous slide, the idea with chickenpox that I want you to circle, star, highlight is that it does reactivate later in life as shingles. And what's really interesting is depending on which nerves it goes dormant in, ends up producing different patches or locations on your body. So for instance, as you can see here, it ends up only being half of the body that demonstrates the big painful lesions and skin disruptions. Now, like I mentioned on the previous slide, keep in mind that stress and being immunocompromised are the two big factors of when this will reactivate. Okay, now if you had the vaccine instead of being younger and having chickenpox itself, then you don't have to worry in terms of shingles popping up. Okay, and like I said before, this ends up being much more brutal and painful because of the fact that the infection went into the nerve ganglia. Now, just a reminder with our good old friend herpes, the other version of herpes viruses, you are already aware that there's type 1 and type 2, so they call it herpes simplex 1, herpes simplex 2. We discussed in another lecture how it used to be that type 1 was up top on your mouth region, so you get lesion sores on your mouth, whereas type 2 was genital herpes back in the day. But nowadays, type 1 and type 2 are found in both locations, on the mouth and the genital region, and they will cause sores in either location because of, again, the way sexual practices have kind of change the inoculation of these infections. Now keep in mind that the herpes viruses, like other herpes that we discussed so far in this class, they go latent. You're stuck with it for life, And you can catch it without the person even showing any blisters or symptoms. So people can be asymptomatic and transmit it to you. And that's very scary considering that a big chunk of the population worldwide does have this infection. And because so many people have it, I've heard some students kind of brush it off and think that it's not that bad of a thing. But it is bad because anytime you have an infection, it does things to your body that you may not even expect. Now, first of all, like we said, when viruses go latent, they tend to go latent in nerve cells. So reactivation of herpes can actually cause some brutally painful effects as they're popping out of these nerve cells, and you have to be careful that they don't end up doing any damage, especially since some of these reactivations are near the spine or, part of your mobility and motility. And so you have to be very careful with infections like this. Also, a lot of infections now they're finding down the line can lead to various cancers and other health effects. So again, you may think, when you're young, oh, things don't really matter. I'm young. I can do whatever I want, have fun. But it does come back to bite you down the line. So always think of consequences when dealing with the idea of infections like this one. Speaking of those infection consequences down the line, we also have this slide on warts as a big skin issue that can be caused by viruses. And the big culprit of viral skin infections with warts is papillomaviruses. And you've heard that before with HPV, so human papillomavirus. We want you to circle and star and highlight the fact that HPV not only causes warts, but it's become the leading cause of cervical cancer, as well as now throat cancer and rectal cancer. Okay, very important. We've discussed this in detail before, so I won't go through it all over again, but keep in mind that this is a serious infection, and a lot of people have it, and a lot of people are transmitting it asymptomatically, so not even showing the symptoms at the time that you engage in activities with them. Now, they have treatments for the warts themselves, so basically removing some of the skin lesions, things like cryotherapy or desiccation meaning drying out, and some of these techniques such as salicylic acid you've probably also seen with treating acne as well. But this does not cure the infection. You are stuck with the HPV infection for life, and like I said, it ends up down the line causing complications like fatal cancers. Now, those are just some of the examples of skin infections. There are always a lot more, but we don't have all the time in the world, so we're just doing a sampling of each of the systems. Now we're going to move on to the eyes, and with the eyes I always like to point out, fun fact, this picture showing central heterochromia. That eye may look familiar to you, but we won't talk about that now. But the reason I love this is because that's a very cool autosomal dominant genetic mutation that a lot of people have. And when you see heterochromia, that means different colors. And so with this genetic mutation, look at your family members or your friends who have lighter color eyes and see if you see more than one color present. So with central heterochromia, you notice around the center of the eye, there's a second color. So this eye is blue in color with a central ring of brownish yellow or gold in person. And so it's kind of funny because people with central heterochromia, sometimes they have to spend their whole life arguing with others who think that their blue eyes are green because blue plus yellow makes green. And so from a distance, sometimes it visually tricks people. You may also see some friends or relatives who have what they call a birthmark in their eye, which is actually sectoral heterochromia, meaning a section of their eye is a different color. So a lot of times you see it with someone with blue eyes will have a patch of brown or a patch of hazel within one of their eyes. Then the rarest of them all is complete heterochromia, where some people may have two different color eyes. So for instance, one eye will be blue, one eye will be brown. Just a little fun fact from the genetics world. Now, when we talk about the eyes, the main term that I want you to remember is conjunctivitis. So anytime you see conjunctivitis, that tells you that it's an infection of the eye. Sometimes you hear people call it red eye or pink eye especially, but no matter which term you're using, conjunctivitis is an eye infection. And there's a lot of different causes of eye infections. One big one was Pseudomonas, which can really be associated a lot with contact lenses. And Pseudomonas is a problematic bacteria because a lot of the Pseudomonas types of bacteria, they tend to be able to go septic. You see this a lot causing sepsis in hospitals, and they tend to be highly resistant, so they're problematic to treat. Now, Pseudomonas, a lot of times it likes to be in water or hydrated conditions. So for instance, you find it in vases of water, of flowers, the water in cut flowers that people put in, they used to put in hospital rooms or on their kitchen tables. You got to be careful of those things because Pseudomonas really likes it. Also, you find it a lot with using contacts improperly. I had a lot of friends who would think like, oh, my 2-week contacts, man, I get a lot of use out of them. I could do, keep the same pair in for like a month. I'm washing it every night. But they don't realize that when you're not using these lenses properly, you are really at risk of much bigger problems. And trying to save a little bit of money on the contact lens, you end up racking up big medical bills and eye drop bills as well. So always use proper care when you're dealing with your life, with your eyes, because you don't want to end up losing your eyesight even, as some of these infections you'll see can cause blindness. Now, bacteria is not the only ones that can cause eye infection. Another big culprit of eye infections is fungal keratitis, caused a lot of times by the Fusarium fungi. And this was actually on the news way back in 2005 to 2006 when contact lens solution was contaminated. So even the people who were doing everything right with regard to their contacts ended up getting very dangerous infections because the solution itself was contaminated. So it's a little scary to think of. Now, I want to point out one of the big problems with fungal infections are hyphae, and that's those lines that you see here. They basically are extensions that come off of the fungi. These fungal mats that also can collect bacteria as well. So you end up with these biofilms that are even tougher to treat on your contact lenses and in the eye. And they're kind of quite resistant, but you usually can end up treating them. Okay, so always be very careful when it comes to your eyes. Now, another one that we mentioned with regard to conjunctivitis and eye infections is that eye infections are able to be passed down from the mother, especially during the birthing event. And so if the mother has an STD, this then tends to get passed down as an eye infection. So they end up having to put eye drops in the baby's eyes, but it can end up leading to blindness if it's not properly treated right away. And two of the big culprits of that are gonorrhea and chlamydia. And what's interesting is on this slide I point out that not only can these be kind of transmitted through to babies from mothers, but you can also get these through swimming pools as well. And the reason why I specifically point that out is because so many times people think, oh, swimming pools, we put all those chemicals in, I check the pH, or, people, they're so good about keeping it clean and all. That doesn't always work. As you saw in our labs and in the lab class, there's always going to be some infections that are highly resistant. Some that with can withstand different pHs, different salinities, different, products. And so you are at risk when you are, you know, kind of not careful. And so kind of make sure you trust. If you're going into that pool, kind of avoid the big public ones. And make sure you're very good about trying not to get water into your eyes. Never let your eyes open when you're underwater, or try not to get any kind of splashing in your eyes. I know I ruin everything for you. That's the fun part about my job. Then the last thing that I want you to remember with regard to eye infections is trachoma, which is the leading cause of blindness worldwide. And it is, like we just mentioned in the last slide, one of the big culprits of it is chlamydia. And in this case, rather than being transmitted through sexual contact or swimming pools, it's actually usually transmitted via hand contact or little flies. And the big problem with this is kind of like we mentioned with other infections. You can get that kind of matting around the eyes. You could get kind of biofilm formation, and also the scratching that you do can cause scars basically, and that produces, as you're seeing in the pictures, big problems in terms of scratching the cornea and damaging vision. The good news is that there is treatment, specifically oral antibiotics tend to help with this one, but especially since you tend to see this in a lot of third world countries, sometimes they don't get that treatment in time, and that's part of why it's such a big cause of blindness. Now, the last of the systems that we talk about in this class, try not to cry too hard as you wind down and realize that you are almost done with BI 219, microbiology. This one is a very scary one. It's the nervous system. And what's very scary about it is how a lot of these there is no cure, which we're going to see in a little while, and the damage that these can do. So when we talk about the nervous system getting infections, the central nervous system has two big problems with infections. The first problem that makes it tricky is the blood-brain barrier. And what that basically is a bunch of capillaries that rest on these membranes that don't let many materials pass from the blood to the brain, which means that trying to get drugs to these infections when you have infections within the brain is very complicated and very tough to do. So they basically had to do a lot of testing to figure out which drugs can actually make it through. One is chloramphenicol, seems to be able to cross the blood-brain barrier. It's lipid soluble, very small, so it's able to make it through, but most drugs cannot cross. The other tricky problem with nervous system infections or central nervous system infections is that inflammation becomes a very dangerous problem because there's no room for swelling. You have a very rock-hard skull and you have the spinal cord, so any kind of swelling becomes very dangerous because bone, like the skull, can't expand. Okay, so you end up seeing a lot of damage if there's any swelling. And that's what I mentioned earlier with regard to encephalitis being such a big problem. Now, speaking of encephalitis, there's a few terms I want you to know. So meningitis, that's when the infection causes inflammation of the meninges, so those membranes that are covering the brain and the spinal cord. Whereas encephalitis, which we've mentioned earlier, is when the infection is inflammation of the brain. And then you have meningoencephalitis, which is basically both the meninges, membranes, as well as the brain become infected and inflamed. Now, to mention a few examples, you've actually heard some of these throughout this course already. First up, for the nervous system, we have tetanus. And some information about tetanus that I kind of want you to focus on. First of all, tetanus releases exotoxins. And as you know, exotoxins are very, very problematic and very lethal. So in the case of tetanus, they're neurotoxin exotoxins. They specifically degrade proteins required for the normal physiology in the nervous system. So it causes paralysis, and you may think, well, paralysis, that's not that bad, sure, I can't move, but that's not going to kill me, right? Well, it does kill you, because paralysis doesn't just mean your body becomes paralyzed. It also means ultimately your respiratory system and your circulatory or cardiovascular system end up paralyzed as well. So death occurs when the respiratory system and the cardiovascular system shut down from paralysis. Now, when you think of tetanus, I want to remind you that even though most people think of it as the rusty nail causing it, that's not actually what's causing it. It's contracted from spores in the soil. And those spores then have parenteral root entry if, let's say, you get stabbed with that rusty nail or you step on that rusty nail. The other thing I want to point out is that there is vaccination to help prevent this. And so that's the DTaP vaccine, which also prevents diphtheria and pertussis. And so it's funny that a lot of people, when they hear tetanus, they're like, oh, it's okay, you can cure that with the tetanus shot. The tetanus shot is not a cure. It's preventative. It's actually a vaccine, and that's why you have to get it immediately. If you decided like, oh, I stepped on this rusty nail a few weeks ago, a few months ago, I'm going to get it now, that's a problem because it's not a cure. It's preventative. And so you need to get the shot before the infection actually takes hold, while it's still in that low incubation phase. Another one we keep mentioning is botulism, and this is an infection of the nervous system as well. Now, what you've learned so far is the idea of endospores, okay? So botulism, it is caused by a bacterium that can form endospores, which makes it highly resistant. The other problem is that it produces botulinum exotoxin, which is in the form of a neurotoxin. So both tetanus and botulism have the very dangerous exotoxins that they produce, and in this case it's also causing paralysis that becomes fatal when your respiratory or cardiovascular system then shut down. And on this slide it has the saddest picture of the whole semester. That picture up in the right hand corner is actually 12 caskets, 12 deaths in the same family. So 12 family members died back in Oregon in 1924 because they were home canning string beans. And the home canning process was very common back then, but their batch got contaminated by botulism. And like I said before, the neurotoxin is so potent and so problematic that it easily kills one after the other. Now, there are some things when it comes to botulism and, food canning process. There are some things to look out for if you're ever grabbing a can off the shelf. Be wary of cans that have their lids bulging and move up and down. If food projects out or explodes out when it's open, or any kind of like rusting and leaking and even major dents in it, because that might have compromised the airtight seal. Bad smells and bubbles, of course, as well as any hissing sounds when you open them. These are all things you want to be careful of when it comes to botulism. Now, if, however, you just drop the can on the floor and it has a little dent on it, that's not botulism, okay? We're talking about when you see a puffed up top on that same can that has the dent in it, okay? Better to just toss it out, lose the 50 cents or $1 rather than risking botulism. Another lovely one to see is leprosy. And for leprosy, we've mentioned this before with regards to diagnosing it. So remember, with leprosy, because it's caused by a mycobacterium, just like tuberculosis is caused by a mycobacterium, For leprosy, we said that you can use the zeolniacin acid-fast stain. Okay, so for what did we say for leprosy? Make sure to write down that you can use the acid-fast stain to diagnose a culture as being positive for leprosy or tuberculosis, and specifically the red cells. So again, picture the coughing up blood, the blood of losing limbs. The red cells will be positive for Mycobacterium, whereas the blue cells will be negative. And there are actually different forms of leprosy, and because it is neurological, it ends up having some paralytic or sensation loss, as well as the loss of limbs and really disfiguring nodules all over the body. You especially see leprosy in third world countries, but we do still have issues in America. Interestingly enough, armadillos are carriers of leprosy, especially down in Texas and southern states. So as cute as they are, never hug or kiss an armadillo. That's the big lesson to take home from microbiology. Now, bacteria are not the only causes of infections neurological. There are some viral and prion ones, which we've kind of mentioned before throughout the course. And what I want you to do is circle, star, highlight the fact that for any of the ones mentioned on this slide, such as rabies, polio, encephalitis, mad cow, kuru as well, so you could write in KURU under prions. Any of these, there are no treatments. There's only prevention vaccines or hospice. And in the case of ones like prions, the death usually occurs within 12 to 14 months. So the first one to mention here is rabies. And for rabies, I want you to remind yourself that this is a zoonotic infection. And so you would write that as zoonotic, zoonotic, because it's caused by animal bites. Funny enough, most people associate it with picturing a rabid dog, a dog foaming at the mouth and biting you. But dog bites actually aren't the most common cause. It's silver-haired bats, most interestingly. And actually anyone who does research or works in, zoo or outdoor kind of positions, they have to get the rabies shot because bats are so commonly rabid. Now, when we talk about rabies, another interesting point, like I mentioned in the last slide, there's no cure. And so kind of like with tetanus, people assume that the rabies shot that you would get after you get bitten by a questionable animal, they would assume that that's a cure. It's not. It's actually a vaccine. And again, this has to be done as soon as you get that exposure, while the possible infection is still in incubation before it's actually taken hold. Now, what's interesting with rabies is there's another common misconception. People always only associate rabies with that rabid dog, the really aggressive, crazy, vicious animal. But that's only one type of rabies. That's what we call furious or classical rabies. And that happens because of the fact that this is neurological. So it ends up going to the nervous system and the brain, and it can dramatically alter, personality and make them highly excitable. But there's actually the opposite can also happen with this kind of brain damage and neurological impact. And that's the paralytic version. Okay, so that's the one where the animals end up being more like undergrad students, and they sit there looking very unaware of their surroundings, just ultra chill, minimally excitable. That's the paralytic rabies. So don't always assume that the animal has to be highly excited, aggressive, very, energetic. It can also be when they're uncharacteristically sluggish and look confused. Another Another viral nervous system infection that you used to hear a whole lot of, but not so much anymore, is polio. And with polio, it was actually transmitted mainly by contaminated water, which, we've gone through lab why it can be so damaging when water is contaminated. And with this, it may start off as something as mild as sore throat or nausea, but it can end up as viremia. And that's when it's very problematic because viremia means viruses in the bloodstream. So when we keep saying septic and sepsis, that's basically viremia is the virus version of that. And with that, it then enters the central nervous system. And that's where it could end up causing major paralytic effects and can, just like all the other ones we mentioned, end up hitting the respiratory system and the cardiovascular system, shutting them down. That's why you see all of those iron lungs in the picture in the corner. Those were how the patients ended up having to have that machine breathing for them, basically. Now, the good part about this is that there is a vaccine, and like with smallpox, the vaccine helped to dramatically eradicate this issue. But again, that's why it's important to keep up with all of these vaccines so that, problems like this don't pop back up. You then have a little bit more mentioning encephalitis, and some of the big causes of encephalitis are actually arboviruses, meaning arthropod-borne. So especially from mosquitoes. Mosquitoes are the big one, causing things like Zika, West Nile virus, and any of these can end up hitting the nervous system. And a lot of times, any of the infections that target the nervous system are going to cause paralytic issues and can be very damaging. And in the case of encephalitis, the big thing that they do to try and help cut this down is vector control, which we mentioned in an earlier lecture. Things like all those sprayings of parks and residential areas. Now, in addition to viral infections of the nervous system, you also get prion infections, and this is one of my favorite topics. You're already all pros at. This is just to remind you that prions are infectious agents that are misfolded proteins. And remember that as soon as you have, one of this misfolded infectious protein, it then goes around misfolding and corrupting the rest. Like I said, kind of like I do with the students, corrupt them one by one. And in the case of prions, like I said, there's no cure. There's only hospice treatment, and usually the person will end up dying within 12 to 14 months. And the two big examples of these TSE infections that you get from prions are mad cow disease and kuru. And remember, kuru is the one where the tribal cannibals ended up getting infected, where the women and children were dying from this prion disease because they were eating the brains of the deceased loved ones. Okay, so any of the neurological nervous system infections are big time problems. Like I said, they usually don't have cures, and anything targeting that system tends to involve major brain dysfunction and paralytic consequences, which ultimately end up going toward the heart and the respiratory system. So big time problems. Okay, that is it for today. You have made it through the entire course. Now, it has been an absolute pleasure teaching you. And the last thing that I want you to do in terms of our Remind app questions is to send me a message right now letting me know if there's anything within the world of micro, meaning, anything regarding a particular infection or with bacteria, fungi, parasites, viruses, anything at all that you wish we would have covered but we didn't, or that you wish we would have gone into a little extra detail. If you can't think of anything in particular, then feel free to just send a message saying, this is the final Remind app question. Here is some feedback. So you can give me feedback about what you liked, what you didn't like with the way the course was done, if there's anything you wish would have been done a little differently to help you better navigate throughout the semester, okay? And again, even though your name will show up with this, do not feel any pressure or any worry. No matter what you say, whether it's good or bad, it will in no way affect your grade, okay? Thank you and have a great day.